What if the greatest threat to your heart isn't the steak you ate for dinner, but the microscopic war happening inside your mouth right now? For decades, we treated the mouth and the body as two separate entities. We sent you to a dentist for your teeth and a cardiologist for your heart. But in 2026, that wall has collapsed. New research has uncovered a terrifying link. A specific species of bacteria that lives in your gums has been found inside the arterial plaques of heart attack victims. This isn't just about bad breath or cavities. This is about a systemic invasion. Today, we're uncovering the oral microbiome, how your gums are a gateway to your bloodstream, and why your morning routine might be the most important cardiovascular intervention you ever perform. To understand this connection, we have to look at the anatomy of the sulcus, the tiny space between your tooth and your gum. In a healthy mouth, this seal is tighter than a laboratory cleanroom. But when we develop even mild gingivitis, that seal breaks. Scientists call this leaky gum syndrome. Just like leaky gut, this allows pathogens to bypass your body's primary defenses. Every time you chew, every time you brush too hard, you are effectively performing a micro-injection of bacteria directly into your jugular vein. The primary villain in this story is a bacterium called Porphyromonas gingivalis, or P. gingivalis. This isn't your average bacteria. It is an intracellular pathogen. It doesn't just sit on your teeth. It hitches a ride on your white blood cells. It uses your own immune system as a Trojan horse to travel through your carotid arteries and into your heart. Once there, it doesn't just sit. It colonizes. It triggers a cascade of inflammation that causes your arteries to harden, a process known as atherosclerosis. In 2026, we are finding that many unexplained heart attacks in healthy people start not in the chest, but in the jaw. But the conspiracy goes deeper than just bad bacteria. It's about the good bacteria we are accidentally killing. Inside your mouth, you have specific nitrate-reducing bacteria. Their job is to take the nitrates from the vegetables you eat and convert them into nitric oxide. Nitric oxide is the miracle molecule of the cardiovascular system. It tells your blood vessels to relax, lowering your blood pressure and preventing clots. Here's the biohack gone wrong. Millions of people use antiseptic mouthwash every single morning. Research published in the journal Free Radical Biology and Medicine shows that using strong antibacterial mouthwash kills these beneficial bacteria instantly. The result? A measurable spike in blood pressure within 1 hour of rinsing. By trying to get fresh breath, you are effectively switching off your body's ability to regulate its own blood pressure. You are chemically castrating your cardiovascular defense system. This is why we are seeing a massive shift in 2026 toward microbiome-neutral oral care. We have to stop treating our mouths like a bathroom floor that needs to be bleached, and start treating them like a delicate garden that needs to be farmed. If the heart connection wasn't enough to keep you watching, consider the brain. The same P. gingivalis bacteria found in heart plaques has now been discovered in the brain tissue of patients with Alzheimer's disease. The theory, backed by studies from the University of Louisville, suggests that these oral bacteria secrete toxic enzymes called gingipains. These enzymes act like molecular scissors, cutting up the tau proteins in your brain and leading to the formation of amyloid plaques. Your brain has a blood-brain barrier designed to keep toxins out, but P. gingivalis is one of the few organisms clever enough to sneak through. This means that chronic gum disease isn't just a dental issue. It is a slow-motion neurological wildfire. In the lab, we now view oral hygiene as neurological hygiene. If you want to keep your memories into your 80s, you have to keep your gums healthy in your 30s. The leaky gum you ignore today is the cognitive decline you face tomorrow.